Hi everyone, it's 3:30 on Thursday, April 2nd, 2020. Thank you for joining us. I am Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. Today we do not have prepared statements, but we are here to answer questions to the best of our ability. We are joined by Nita Ludwig, Administrator of the Rock Island County Health Department, and Ed Rivers, Director of the Scott County Health Department. Please type your questions in the chat box, and the question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. As for case numbers in Rock Island County, we have 2 additional cases today to report, bringing our total to 21. Ed, what are Scott County's numbers?
So today the Iowa Department of Public Health announced 4 cases, 3 middle-aged adults, 41 to 60 years, 1 older adult, 61 to 80 years. For the state of Iowa, that brings us to 614 cases.
Okay, thank you for those updates. We'll go ahead, since we do not have prepared statements for today and just want to be available to answer some of your questions. We will go to the chat box. We do have our first question. It says, News 8 viewers are looking for clarification on households who have a family member who have an assumed case of COVID-19 or have tested positive. Should only that family member be quarantined, or should the entire household be quarantined? Nita, do you want to address this since you discussed this in your talking points yesterday?
Sure, I did talk about that a little bit yesterday, and I will say that, the guidance does change a lot, and it's a very fluid situation. And I think when I spoke yesterday, I was talking more about the guidance for healthcare workers or essential workers, so it's a little bit different. But if this question is about just a family member with an assumed case of COVID, I will read you what the guidance says on asymptomatic community exposure to a confirmed case. So if it is a household member, an intimate partner, an individual providing care in a household without using infection control precautions, or an individual who's had close contact, that means within 6 feet or less for a prolonged period of time, that person should stay home for 14 days after the last exposure and maintain social distance from others at the same time. And self-monitor for symptoms, check their temperature twice a day, watch for fever, cough, or shortness of breath, and avoid contact with people at higher risk for severe illness. And follow the CDC guidance if symptoms develop, and call ahead to talk to a healthcare provider.
Do you want to include that for Iowa and what the recommendations are here?
Yes, and let's clarify, we're talking about isolation. Quarantine is something different. That's a legal action. So isolation recommendations for well Iowans with potential COVID-19 exposure. Iowans should stay home and isolate themselves from other people and animals in the home in the following situations. Isolation should be in place for 14 days after the last exposure. These situations are if you've traveled outside of Iowa for business or vacation in the last 14 days, taken a cruise anywhere in the world in the last 14 days, and applicable to this discussion, live with someone who has symptoms of COVID-19 or has tested positive for COVID-19. So yes, in Iowa, if you live with a person who's positive, you should isolate for 14 days. Now you can stay at home and isolate until these things have happened. After your 14-day isolation, you've had no fever for at least 72 hours, and other symptoms have improved, and at least 7 days have passed since your symptoms first appeared.
Thank you. The next question, there's a couple of things that go in there, so perhaps we could speak generally about businesses and public places that are still open, such as grocery stores. What precautions should grocery stores take for their workers, also take for their customers, and similar, what should restaurants be doing, those that are still providing carry-out or curbside pickup. Ed, do you want to start with that?
We'll go back to the social distancing. Cover your cough. If you're ill, stay home, don't work, as well as possible inside a business establishment. Maintain that 6-foot distance. Wash your hands frequently. Make sure that you're not contaminating surfaces and cleaning frequently. Touch surfaces often. This should be happening in a restaurant anyway. Cleaning and sanitizing should have been going on in restaurants before this event began.
We have a second part to this question. Nita, perhaps you could answer this. Should all workplaces be taking the temperature of anyone coming to work or to a store? That's the first part of the question. Could you address that, Nita?
Sure. I mean, I think that is a business decision. Every business is able to make their own policies and protocols. I have heard of some businesses starting to take the temperature of their employees when they come on shift, but I don't think every one of them is. So I think right now it's up to the business.
Nita, I'm going to ask you to do this next question again. This went back to some of the description you gave yesterday. If someone could give an in-depth explanation on how someone should approach living with a person with COVID-19. I think you were describing some of the precautions to take if you're in the same household.
Right. I think that's the very same description that I just gave earlier. So the household partner living with someone with COVID-19, and I think Ed spoke to this too, they should stay at home and isolate for 14 days after that last exposure, and to self-monitor, checking their temperature twice a day, watching for fever, cough, shortness of breath. This is a slide by the Illinois Department of Public Health, so I can make that available if that will help clear it up for people.
Thank you, Nita. Next question, what should pregnant women do? That's the first part of the question. Nita, have you had that come up with any of the individuals you've received questions from, and how have you been directing them?
Yeah, I have not had that question come up, and I think, there isn't a lot of information yet on COVID-19 and pregnant women. The question that I had come up was someone that was a healthcare worker, and the guidance from CDC on if you're pregnant and a healthcare worker, you might be able to be reassigned to a different location temporarily so that you're not exposed to COVID-19 patients.
Our next two questions relate to the hospitals. Ed, perhaps you could just give some general information on this. Are hospitals taking precautions, and how many people may still be hospitalized in each county with COVID-19?
We don't have that information. We don't have access to that information, but I've been made aware of a website. I can't vouch for the accuracy of it, but it does have a more granular breakdown of the total confirmed cases, male and female, children, adult. It lists currently hospitalized, never hospitalized. That website is coronavirus.iowa.gov.
If you have any additional questions, we encourage you to put those into the chat now. We will go ahead and mute the line until we get an additional question.
Brooke, I see that.
Yep, sorry about that. Go ahead. Sorry about that, Nita.
So someone was asking about hospitalized people on the Illinois side, and we are still at the same number as yesterday. So yes, it is still 5 people in Rock Island County that are hospitalized at this time.
Okay, seeing as there's no additional questions, we thank you for joining us today. We continue to need your assistance in sharing messaging with the public about the importance of staying home, maintaining a 6-foot distance from one another when we need to be out and about for essentials, whether it's indoors in public spaces or in the outdoors, and self-isolating at home if symptoms begin to show. We anticipate a press briefing occurring tomorrow again at 3:30, so we will talk with you at that point. Oh, looks like we had an additional question come through. Should a parent feel it's okay to send their son or daughter to work at a grocery store? Do we have guidance for that, Ed, or suggestions related to what you were saying with cleaning and hand washing, those types of things?
Well, as we've continued to advise, anytime you take trips outside the home, you should follow the social distancing recommendations. Try to maintain 6 feet between yourself and others. Cover your cough or sneeze with your elbow or a tissue. Stay home when you're sick, and if people are showing signs of illness, distance yourself from them.
We also have brought up the information for the Together Quad Cities website that has additional information on, as the last question has here, related to homemade masks. It provides guidance for the creation of masks, as well as guidance from the State Health Department on the use of those masks. So that information is available there. There's also plenty of additional information on community resources that the public can use and access for some of the questions they might have or where they could get assistance during this time. Again, we appreciate your assistance and we look forward to talking with you again tomorrow. Thank you.